got a very bad right knee, and my right leg is significantly shorter than my left, and it's really caused me back issues.
A couple months ago, I started feeling kind of the pain in my left leg, and towards the end of January, it was really shooting all the way down to my heel.
Never had back problems. One day I just bent over, felt something pop, and then I experienced the worst pain I've ever experienced.
This is the decompression table right here. This is a spinal decompression table because there is multiple tables. This is called the DTS, and this table allows us to, of course, do certain things like raise the legs upwards, which makes it more comfortable, and then the individual will have their feet or heels on here, which relaxes the lower back, making the decompression that much more effective in the lower back area. These are harnesses. This one's going to go around the waist, and this one is going to go just above the waist area, and all kind of overlapping, so that we can concentrate and focus on that particular level.
Coincidentally, I worked for a pain doctor, so I did, seek his help. I took pain relievers that just really upset my stomach, or just never addressed the pain, just gave me all these side effects.
Decompression is able to use on someone in their early 20s. We even have someone late teens because they actually fractured their vertebra in their lower back, and we were able to help them avoid back surgery with part of the spinal decompression, as well as specific strengthening exercises for them. The thing that makes us unique is that not only do we use the spinal decompression, but we utilize what is called the electrical muscle stim, designed to help relax the muscles, so that as we're opening up your spine, because this table will separate, we're able to relax those muscles, which allows the effectiveness of the spinal decompression to be that much greater.
My last flare-up was the ultimate worst. I was probably in bed for like a whole week. I couldn't move at all.
The table has a vibration unit, so by doing the vibration, it stimulates the cerebellum, and then the cerebellum then communicates to those muscles, and of course allows those muscles to relax, which then allows the spinal decompression table to be that much more effective.
An AVP pro volleyball player, that's the son of one of our really good friends, said that I should really try this, because it's really had done significant things for him.
It makes us very unique. Besides the muscle stim, the whole body vibration is oxygen concentrators. The oxygen concentrators mean that they're pulling oxygen out of the air. They're concentrating it anywhere between 94 to 97% pure. This is not a tank. Of course, the oxygen tanks that you see people using, that's 100% pure oxygen. By doing that, we're now adding another aspect as far as oxygen therapy, which again is stimulating the cerebellum. So not only does vibration help stimulate the cerebellum, but so does oxygen therapy.
A couple of patients took an aspirin just to dull the pain, and of course then it wouldn't go away, it just would come back, and then come back with a vengeance.
I had lower back issues for 25 years, maybe even 30.
For every year above the age of 20, our body's ability to assimilate oxygen decreases by 1%. So let's say that you're 40 years of age, you're 20 years above the age of 20, which means that you've lost 20% of your body's ability to utilize oxygen. That becomes real critical, and as we go through this aging process.
A little kid that you want to sit there and play with and do stuff with, and then, when they start calling you like, "Oh, mommy, does your back hurt?" That's like heartbreaking for me.
Also, this table allows us to also put people on their stomachs. We would just move these, which are bolsters that go behind the knees, and we would place the patient on their stomach.
It was major lower back pain. I couldn't sleep. A lot of aspirin, a lot of Advil, a lot of stuff like that to try and get this under control. When as soon as I came in here, you guys really fixed me up. I mean, it's 100% better.
There's arthritic changes in the spine, spinal stenosis, bulging disc, herniated disc, as well as sciatic type pain.
Strengthening exercises, and so as I do that, I start to see more of the difference.
Having discovered this, I'm back now playing golf. I play golf twice a week. I go to the range a couple of times a week. I mean, I'm just, I'm relatively pain-free right now.
But this does allow us to do cervical as well. So we have many people that have cervical arthritis, again, bulging discs in their neck, people that have what we call radicular pain that might radiate down their arm and into their hand, and that becomes so severe that now they are losing the strength of the grip.
The thing I found that I really enjoyed was the fact that after just a couple of decompression sessions, was partway through a session, that the pain down my leg would actually disappear, that it would be gone. And I was like, oh man, I love it. This is even better than aspirin.
Thing that this does allow, spinal decompression, is to not have the muscles go into a contracted or spasm state. Many people that have had traction therapy before in the past, they noticed that they might have had traction therapy that felt great while they were doing it, but then they couldn't get up and walk.
Compared to the way it used to be, I'm extremely pleased.
Also, what makes us unique is we're going to start people at a lower weight than most offices will do, and the reason being is because not everyone's the same. You got to take in the factors of age as well as your spinal condition, and that's why we always have X-rays or we have MRI reports to go ahead and look at and to justify what we're doing.
With the pain, that's the one thing that really bugs me, is to think that, oh man, if I wouldn't be able to do my job even, that's been a lifesaver, has been the decompression, is feeling like, wow, I can still do my job.
As far as, looking at the type of care, though, what would you say as far as recommendation here, going
It's top notch.
top notch?